And practice questions of reviewing the diseases and illnesses that were discussed in our cardiovascular review video. Just like with all of our practice question videos, I would like you to pause the video after we initially review the question and the answer options. That way you can select the correct answer independently and then restart the video once you've chosen your answer option. That way we can go over the rationale together. All right, so this is our classic multiple choice question. This question is going to test your knowledge of physiological integrity, which includes risk factor reduction. A patient with a history of myocardial infarction suddenly becomes tachycardic, shows signs of air hunger, and begins coughing frothy pink-tinged sputum. When auscultating the patient's breath sounds, the nurse can anticipate which of the following. So before moving on to the answer options, what disease process do you suspect? The patient is tachycardic, showing signs of air hunger. They have frothy pink tinged sputum. So start thinking about what that may be. And then once you can kind of pinpoint what those symptoms may be pointing to, it will help you better answer what the nurse can anticipate finding. So your answer options are stridor, crackles, scattered rhonchi, or diminished breath sounds. All right, so once reviewing the question, you should suspect pulmonary edema, and the main thing that's going to stick out is that frothy pink tinged sputum. That is very characteristic and classic of pulmonary edema. So once you suspect pulmonary edema, you're going to know that auscultation of the lungs are going to reveal crackles. Rhonchi and diminished breath sounds are not associated with pulmonary edema. And stridor is a crowing sound, and that's usually associated with spasm of the larynx or edema of the upper airway. So you are going to recognize that frothy pink tinged sputum as pulmonary edema and know that upon auscultation of the lungs, you will hear crackles. All right, so this is a highlight in text style question. Again, this is going to test your knowledge of physiological integrity. The nurse is caring for a patient who had cardiac surgery 24 hours ago. The patient has had a urine output averaging 20 mLs per hour for the last 2 hours. The client received a single bolus of 500 mLs of IV fluid. Urine output for the subsequent hour was 25 mLs. Vital signs are as follows. So BP is 136/82, O2 is 95%, and heart rate is 88. Daily lab results indicate that the BUN is 45 and the serum creatinine level is 2.2. Click to highlight the findings that are of immediate concern to the nurse. So I want you to select which of the findings are of immediate concern to the nurse and need to be reported to the provider. Okay, so the patient who has had cardiac surgery is always going to be at risk for renal injury or kidney injury from whether it be poor perfusion, low cardiac output, or vasopressor medication therapy. So for this particular patient, you are concerned about an acute kidney injury or an AKI, which is signaled through decreased urine output and an increase in BUN and creatinine levels. So just for your reference, a normal BUN is 10 to 20, and a normal creatinine, depending on male or female, is about 0.5 to 1.1 or 1.2. So this patient is probably going to need medications to increase their renal perfusion, and then, if their creatinine and BUN does not improve, they may even need peritoneal dialysis or hemodialysis. All right, this is our drop-down style question. So you will see your options for 1 and your options for 2. Again, this is going to test your knowledge of physiological integrity. The nurse is caring for a patient on the cardiac unit, currently on telemetry. The patient is in sinus rhythm with a heart rate of 78 beats per minute and has a PVC, or premature ventricular contraction, that falls on the T wave of the preceding beat. The patient's rhythm suddenly changes to one with no P waves, no definable QRS complexes, and coarse wavy lines of varying amplitude. The patient reports feelings of dyspnea and palpitations with a calculated BP of 82/50. The nurse determines that the patient is presenting with blank as evidenced by blank. Now, there's a lot of distractors in this question, but I want you to focus on no P waves, no definable QRS complexes, and coarse wavy lines. So go ahead, pause the video, and get your answers for options 1 and 2. All right, so you should recognize that the patient is presenting with VFib, or ventricular fibrillation, as evidenced by no visible P waves or QRS complexes. So your distractors here are feelings of dyspnea and palpitations with the low blood pressure. So those symptoms are not specific to ventricular fibrillation, and they may be present with a number of different dysrhythmias. So you need to ask yourself, look at the telemetry readings, the lack of P waves and QRS complexes, and that indicates that the patient is presenting with ventricular fibrillation. All right, this is a matrix multiple response style question. This is going to test your knowledge of physiological integrity. So this is pretty straightforward. It's going to test your knowledge between knowing the difference between right and left-sided heart failure. So for each patient finding below, click or specify with an X if the finding is consistent with right-sided or left-sided heart failure. So this is just one of those things that you need to know the difference of when it comes to the NCLEX. It's going to help you to be able to accurately answer questions and then rule out answer options as well. So your patient findings are abdominal distension, pulmonary congestion, lower extremity edema, dry cough, and dyspnea. So I want you to go through and determine if that symptom is associated with right or left-sided heart failure. All right, so remember, right-sided heart failure is a lot to do with the GI system. So you're going to have the dependent edema, the lower extremity edema, abdominal distension is going to be right-sided heart failure. And then just remember, left is for lungs, so your left-sided heart failure are going to be your lung or your pulmonary symptoms. You're going to have dyspnea, tachypnea. You're also going to have some dry cough and pulmonary congestion as well. All right, this is a classic multiple response, select all that apply. This is going to test your knowledge of physiological integrity. The nurse is caring for a 55-year-old patient who is admitted with fevers and a history of mitral valve prolapse, who reports taking antibiotics for dental procedures in the past. The admitting physician orders blood cultures on the patient, which are positive for streptococcus, and then also a transesophageal echocardiogram shows vegetation on the patient's mitral valve. The patient is diagnosed with infective endocarditis and started on IV antibiotics. Which of the following manifestations are associated with infective endocarditis that the nurse should anticipate? Select all that apply. So what are the signs and symptoms of infective endocarditis? And when you see these things, you need to think endocarditis. So our options are chest pain, splinter hemorrhages, Osler's nodes, hypertension, a new onset murmur, and Janway lesions. All right, so as we know, infective endocarditis is an infection of the inner lining of the heart, or the endocardium, and then also of the heart valves. So it can often be caused by bacteria, viruses, or fungi, and it can lead to complications including heart failure, stroke, of course, sepsis. So the manifestations always can vary depending on the severity of the infection, but common signs include fever, chills, headaches, night sweats. In addition, endocarditis can cause a lot of skin and nail changes. So these include splinter hemorrhages, which are going to be the dark brown or brown linear lesions in the nail bed, Osler's nodes, which remember are painful red or purple nodules on the fingers or toes. Then you're going to have Janway lesions, which are the painless red spots on the palms and soles. And then you can also see a new onset murmur. Not included here is, of course, shortness of breath, cough, joint pain. And then know that hypertension is not typically associated with endocarditis.